Let's start with homeostasis. This is the body's ability to maintain equilibrium between all of its various regulatory processes within the body, overcoming constant changes within and outside the body via feedback loops. Blood pressure homeostasis is the process we are going to discuss now. Blood pressure is the force exerted by systemic blood flow on the walls of the vessels. There are three parameters to maintain the homeostasis of blood pressure: cardiac output, blood volume, and resistance. Blood pressure is measured using a sphygmomanometer in millimeters of mercury and is recorded by measuring the peak pressure achieved when blood leaves the ventricles of the heart, called systolic pressure, and the lowest retrieved pressure by atrial circulation, diastolic pressure. Normal blood pressure has a systolic blood pressure of 120 milligrams of mercury and a diastolic pressure of 80 milligrams of mercury. Hypotension or low blood pressure is an adult systolic reading of 90 milligrams of mercury or less, whereas hypertension or high blood pressure is an adult systolic pressure greater than 140 milligrams of mercury. A systolic blood pressure between 120 and 139 milligrams of mercury is considered pre-hypertensive. The cardiovascular system, that's a part of the autonomic nervous system, controls heart rate and force by sympathetic nerve impulses that release norepinephrine to increase heart rate and contraction, and parasympathetic impulses that release acetylcholine to decrease heart rate. Epinephrine or norepinephrine, when released into systemic blood vessels from the adrenal medulla, have the ability to cause vessels to widen, vasodilation, or become narrower, vasoconstriction, which directly affects blood pressure. Baroreceptors are pressure receptors located in the arch of the aorta and carotid arteries. They relay information about the blood pressure to the cardiovascular center in the medulla oblongata along the vagus 5 nerve. If blood pressure becomes too high or low, negative feedback systems come into effect and the cardiovascular center sends nerve impulses along to the nodes of the heart to return blood pressure to normal. Age, infections, smoking, fitness level, and diets high in fats and salts are some factors that directly affect blood vessels and pressure. Blood pressure outside the normal range can be regulated by medications. However, the body has many systems in place to maintain normal blood pressure in a healthy individual. The renin-angiotensin mechanism is one of these systems and is stimulated when blood pressure, volume, or sodium to the kidneys is reduced. Granular cells of the juxtaglomerular apparatus of the kidney then release renin into the blood. Angiotensinogen converting enzyme changes angiotensinogen that are both found freely in the blood into angiotensin 1, and is then catalyzed in the lungs to angiotensin 2. Angiotensin 2 stimulates vasoconstriction in the systemic arterioles, causing an increase in peripheral resistance. It also stimulates the adrenal cortex to release aldosterone that targets sodium ion reabsorption in the kidneys, leading to water retention, and stimulates the hypothalamus to release antidiuretic hormone from the posterior pituitary, minimizing the formation of urine. Lastly, it stimulates the thirst response, causing the individual to drink fluids. All of these processes increase blood pressure, volume, and sodium levels. The release of renin stops upon normal blood pressure and volume to the kidneys. In summary, many homeostatic mechanisms are in place in the body to maintain a functional blood pressure. They are carried out by negative feedback loops that involve sensory receptors, cardiovascular center control, and hormonal secretions. Thanks for watching.
Created using Powtoon.